Hello, dear students. Welcome you all to the Master Nursing classes. Myself, Mr. Nagaraj, your NORCET mentor and guide, here in front of you all today to discuss the very important topics for the Nimhans examinations. Yes, students, in the last previous class, we have discussed the very important topic related to the schizophrenia, all type of the schizophrenia we have discussed, and the very importantly antipsychotic medications. What all are the nursing responsibilities? What to assess? What not to assess? What is the priority? Each and everything we have discussed in the last previous sessions related to the schizophrenia and antidepressant medications. Okay, so and before that one in the part 2 day 2 sessions we have discussed all mood disorders. Okay, so very importantly in today's sessions I am discussing in the day 4 session of the crash course. Here we are discussing the electroconvulsive therapy. Okay, so along with the electroconvulsive therapy, I am discussing all the neurotic disorders that including the, yes, very importantly, anxiety disorders, anxiety related other disorders like phobic anxiety disorders, panic anxiety disorders. Okay, along with that, very importantly, I am also discussing the obsessive compulsive disorders, very important clinical features of the obsessive compulsive disorders, and the therapeutic modalities that used to treat the anxiety and anxiety related symptoms that including the systemic desensitization, flooding, okay, biofeedback, each and everything, the important terminologies that going to come in your NORCET exams and Nimhans exams, we are discussing here. Very important sessions over the psychiatric for the Nimhans, that is in the day 4 crash course session, students. So without wasting time, we'll start our class here. So here is the one beautiful motivation quote for you all. Yes, study hard, students, and dream big. So if you are studying hard and your dream is big, means that is the way also somewhat difficult. So your dream is very short and sweet, means your struggle also not needs that much. So you want to work in the aims, you want to work in the reputed central government institute like Nimhans, means the way to approach or the way for the success is somewhat difficult, but who will come out of the difficulties is the champion, students. So I think you all are the champions. Yes, I always tell, act like a champions, think like a champions, and be a champions. Okay, so without wasting the time, we will start our class. Yes, here is the one first beautiful questions here. So we will start with very basic and I will go for the very broad topics here, students. Yes, here is the one basic question for you all. Try to answer for this question. Read the question carefully. Read the question carefully and completely. All options read carefully and completely. Then come for the conclusion and answer. Okay. So don't do gadbad for any questions. Okay. So here is the first question for you all. ECT, electroconvulsive therapy, belongs to which of the following psychiatric treatment category? Okay. So students, we are having the various psychiatric treatment category where in we are having option A as in psychopharmacology, psychosomatic, psychosocial, and option D is all the above. So students, where we are using some drug, some medicines to change the psych, means the mental ability or the mental status, mental function of the person, that particular drug, the medicines we call the psychopharmacological agent. Okay, the therapy we are giving to alter the mental function of this person, that is what we call psychopharmacology. Here we are using the drug. Okay, also we call the medicine. Okay, so we are using the medicine to treat the patient of the psychiatric conditions, that is what we call the psychopharmacology. Okay, and here one more word is that psychosomatic. Students, what is the somatic? Somatic related to the something physical, that is something related to the body. So we are using some external electrical electrodes, okay, directly over the body to induce some therapeutic effects. That is what we call psychosomatic, students. In the psychosomatic modalities, we have very important one I am talking. We are having the two things here. That is electroconvulsive therapy with, and also we are having the light therapy. So both these two things are used in patient who is having the severe psychosis, severe melancholic depression, severe mania, okay, and other organic brain disorders also we are using this therapy. So here we are discussing the electroconvulsive therapy. Okay, I will each and everything I will explain here, that is related to the definition, what is the current use, what is the voltage, what is the duration, everything we will discuss, students, one by one. Okay, so here is the first question. I hope the question is clear for you all. If you are using the drug that comes under the category of the psychopharmacology, and if you are using the something like the physically we are using something to the patient, we call that is the things which will comes under the psychosomatic one. Okay, so very important one. And some therapies will comes like behavioral therapy and all, so that one it will comes in the psychosocial one. So all of the above is not answer, so answer for this question is the ECT belongs to the psychosomatic one. I hope the concept is clear for you all. Let me go for the next question. Okay, here is the very one more very basic question for you. So, who is the founder of the electroconvulsive therapy? Who is the founder of electroconvulsive therapy? So, yes, students, option is there like this: Joseph Wolfe. Joseph Wolfe is the person who found. Yes, what is the contribution of the Joseph Wolfe in the psychiatric nursing? That is, he found systematic desensitization model. Okay, systematic desensitization model that is used to treat the phobia and anxiety patients. Okay, phobia and anxiety and obsessive compulsive disease condition, where we will use a systematic desensitization technique here, that is found by the our Joseph Wolf. Okay, very big contribution to the mental health nursing. Okay, and option B we are having the yes the Maxwell Jones. Maxwell Jones is the person who found yes our therapeutic community. Who is the founder of the therapeutic community? Yes, try to answer for this question. Who is the founder of the therapeutic community? Yes, very good. That is our Maxwell Jones is the founder of the therapeutic community, where we are using the patient community, patient environment only to treat the patient, where we are changing, manipulating the environmental treat to bring some positiveness in the patient. So that is what we call the therapeutic community. Okay, that is discovered by our Maxwell Jones. Okay, and we are having the one more personality here as on Hildegard Pablo. Hildegard Pablo is the founder of the yes, very important, that may comes in our exam. That is the she is the founder of the interpersonal relationship theory. Okay, IPR or interpersonal relationship theory is discovered by the Hildegard Pablo. Okay, and also called as mother of psychiatry. Who is the mother of psychiatry? Mother of psychiatry is yes, very important, our Hildegard Pablo. Okay, and here we are having the option D, that is then B and C. There is the Binney and Carletti is the personalities who discovered the yes the electroconvulsive therapy. How you will remember this one? Yes, E and C is discovered by the B and C. Okay, so Binney and Carletti is are the founder of the yes the our electroconvulsive therapy. Okay, very important to keep in your mind. Remember like this, it may comes in our exam, that brings to very important 1 marks. Okay, yes, here is the next question for you all. Yes, read the question carefully and try to answer for the question, students, because the very basic and informative questions for you all. Yes, here is the question for you all. Which type of convulsion will be artificially induced in the electroconvulsive therapy? Yes, what we will do here in the electroconvulsive therapy, let me clarify the concept here first related to the ECT. So when the patient brain is completely stuck, when the patient brain is abnormally thinking and acting, so when the patient brain inducing somewhat psychotic symptoms like hallucination, delusion and illusion, okay, at that point of the time, in order to bring that particular brain functions to the normal, here in order to bring that particular abnormality to the normal, here we are inducing one psychosomatic therapy. That therapy we call the electroconvulsive therapy. What actually we will do in the electroconvulsive therapy means, students, so we will apply two electrodes, okay, two electrodes directly to the brain. Okay, so and we will induce some current to the brain for only short duration. Okay, only short duration, that duration we will discuss in the next question. So for only short duration we will induce that electrical current to the brain, so which brings the neurochemical changes in the brain. Okay, that neurochemical changes brings the patient out of the psychotic. This is the actual belief who started the yes the electroconvulsive therapy. Okay, what we are doing in the electroconvulsive therapy, the word itself indicating we are giving some electrical current to artificially induce one convulsion, one seizure episode. That is what we call the electroconvulsive therapy. Okay, so we are using some current to induce the some seizure. That is what we call yes electroconvulsive therapy. So which type of the seizure we are inducing, that is in the exam question. Okay, which type of the seizure we are having, the various partial seizure, complete seizure, each and everything we have discussed in the seizure 1 2 part of our neurology sessions. Okay, so we are having the various type of the seizure like the generalized clonic tonic seizure, myoclonic seizure, absent seizure, partial seizure. Okay, these all are our type of the seizure, students. So which type of the seizure we are inducing? Yes, the very good students, you all are answering very beautifully. I am hats up into your consistency. I am hats up for your dedication, students. Be connected with the master nursing classes. We will change everything, students. We will change everything. I'm trying to bring very important questions that directly comes in your exams with same options, students. Okay, so here is the answer for your questions. Yes, option A is the generalized tonic clonic seizure. This is what actually we will artificially induce in the patient with the electroconvulsive therapy. That is then generalized the clonic seizure. This is also one more exam question. This is also called as grand mal seizure, students. Okay, please remember this is also called as in the grand mal seizure. Okay, so option B, myoclonic seizure is there. So only not only clonic seizure, with clonic tonic seizure also will inducing. So these all option B, C, D is not our answer. Partial seizure, absence seizure, myoclonic seizure. So generalized tonic clonic seizure is our answer here. So answer A goes to correct answer. So what we will actually do here means we will induce the cranmal seizure, that is a generalized tonic clonic seizure. Okay, very important two pages are this generalized tonic clonic seizure is the word itself saying there is an as the tonic phase followed by the clonic phase. Okay, so the tonic phase goes for the duration of the 10 to 20 second. Okay, and the clonic phase goes for the duration of the 30 to 40 second. Don't confuse, students. In your psychiatric book they have given for the tonic phase 10 to 15 second they have given, and for the clonic phase they have given the, yes, very importantly, 30 to 40 second. But according to standard books, it's in 10 to 20 second and 30 to 40 second, and the complete duration of the generalized tonic seizure should be 30 second. So this is for 60 second. There is the 20 plus 40 is 60, where the tonic goes to 10 to 20 second and tonic goes to our 30 to 40 second. Very important, students. Here I am somewhat paused because our Nimhans exam is very near. I am trying to cover the whole topic for you all. So here I am somewhat paused. If you have any doubt and difficulties, please comment in the comment box at the end of the session, and whatever the points I am telling you, please note down your notebook and revise twice. Okay, very important one. Okay, here is the next question for you all. Yes, read the question carefully and try to answer for the question. Okay, time duration of electroconvulsive therapy according to the American Psychiatric Association. What is the full form of the APA? That is the American Psychiatric Association, who given the, yes, the Diagnostic and Statistical Manual Classification, DSM. Okay, classification is given by the American Psychiatric Association. What is the question here? The time duration of the electroconvulsive therapy according to American Psychiatric Association. Option A comes to 0.7 to 1.5 minute. Focus over the end of the question. Okay, and option B is 0.7 to 1.5 second. Okay, option C is 0.7 to 1.5 hour. Okay, and option D is 3 minutes. We will eliminate option D because it's completely unrelated. So we have studied, so 0.7 to 1.5. I know what is the end of the answer. I need to mention, that is I don't know. Here the master nursing classes Mr. Nagaraj is telling. Okay, Mr. Nagaraj sir is telling that please focus over the end of the value which are entirely changing. So please do read the options, all options correctly. At that point of the time, your answer is going to 100% right. Students, you all are studied, you all are struggling, I know, but please focus and study. Okay, the hours will not matter, students. The focus will matter. Okay, you are complete studying with focus for 4 hours is more than enough. And you are with distractions you are studying up to 8 hours means that not going to help. With focus you are studying means that is very effective, students. Please focus over the complete question and complete answer and make your answers right. So we will not give for a minute and hour, students. Only the electrical activity we are giving only for the period of the second. Here the 0.7 to 1.5 second is your answer, not a minute, not a hours. Okay, so I hope the concept is clear for you all. We'll go for the next one. Okay, next question is like this. Here is the, yes, question for you all. Simple questions that comes with like a clinical scenario based questions like See, I will create one scenario. I'm trying to create one scenario based question over this question only, same question. Here, the nursing officer is working in the electroconvulsive therapy department, and the student nurse asked to the nursing officer that, sir, what is the actual value we need to set to give the current for the patient who is undergoing the electroconvulsive therapy? So, what is the nursing officer response to the nursing students over here? Okay, so simple, that much big question. I have converted to this much. Okay, that is the voltage of ECT according to American Psychiatric Association. The language of the question are changed. First, the actual meaning at the end of the question, they want to ask what is the voltage value of the, yes, the ECT where we are giving to the patient with psychotic, okay, symptoms. So I hope the concept is clear for you all. How the examiner may create the question here. The voltage of the ECT according to American Psychiatric Association is, option A is 70 to 120 volts. Option B is 20 to 200 to 360 joules, and option C is 120 to S 200 joules. Yes, and option D is all the above. Students, in the electroconvulsive therapy, we are giving very importantly 70 to 120 volts is the current where we are giving in the patient with electroconvulsive therapy. Okay, in the ECT, we are giving 70 to 120 volts when we are giving the current in the defibrillator machine. Okay, the defibrillator with monophagic effect. Okay, monophagic means the current will form passes in only one direction. So in the monophagic, we need much current. That is where the minimum current that we need to send in the patient who is undergoing the monophagic defibrillation. Okay, with the defibrillator machine. So our minimum current should be starts with the 200 and maximum it goes up to the 360 joule where we are giving the biphasic current. Okay, biphasic current means the current direction two direction from the upward to down and downward up towards the heart. Okay, that is what we call the biphasic defibrillator, biphasic defibrillator, where the minimum current starts with the 120 and maximum goes to up to the 200 joules. Students, here is the two more questions we have covered. What is the range of the current will set, or the range of the energy will set in the monophasic defibrillator is the 200 to 360 joule, and in the biphasic defibrillator 120 to 200 joule, and in the electroconvulsive therapy 70 to 120 volts. So the answer for the question goes to option A is the correct answer. Hope the three questions are covered with the one question here. Okay, let me go for the next question. Here is the next question for you all. Here I am trying to cover entire topic of the electroconvulsive therapy, because from the ECT every year there is at least one question will arise in all the questions, all the central government exams. Okay, especially in the Nimhans, it's mandatory to study the electroconvulsive therapy. Okay, so here is the question for you all. Yes, the question read carefully and then comes to the options. Which of the following is false about the ECT? Which of the following is the false about the electroconvulsive therapy? Okay. Here is the option for you all. Option is like this. Yes. Direct type of ECT given without anesthesia and muscle relaxants. Okay. Option is like this. Yes. Students, we are having the two type of the ECT, where type of the ECT is categorized based on the use of the anesthesia and relaxants. If we are using the anesthesia and muscle relaxants, that is a modified ECT, or we call that is an indirect ECT. And without anesthesia and without muscle relaxations, we are inducing the electroconvulsive therapy we are using, means that is what we call the direct ECT. Students, according to the, yes, the mental health care bill option, mental health care bill. So the use of the ECT without anesthesia and muscle relaxant is contraindicated. But yes, in the type of the ECT while we are studying, so we will study the direct type also. But nowadays it's not using, that is the outdated one. Okay, outdated one. But this is a true one. Okay, this is a true one where previously we are using to give the, yes, the electroconvulsive therapy without anesthesia and without muscle relaxants. Okay, so here is the next option for your option B, the modified type of the ECT given with anesthesia and muscle relaxants. It's 100% true, and option A is also 100% true. Previously we are using that one, nowadays we are not using. Okay, So we need to know what is the false. What is the false one? Okay. So here is the option C for your. In unilateral ECT, electrodes are applied on non-dominant side of the body. Okay. Yes, the 100% true, students. I will explain this one here. Okay? I will explain. Let me wait and answer for the question. So, and option D is like this: used in patient with the increased intracranial pressure is not and makes sense to answer this question. This option here. Why? Because students, in the increased intracranial pressure, there is only one absolute contraindication for the electroconvulsive therapy. Is the only one absolute contraindication, that is the increased intracranial pressure, where we will never ever use the electroconvulsive therapy in patient with increased intracranial pressure. So other contraindications are there, but the absolute one is the yes the raised ICP, where we will never ever use the ECT. Okay. So let me come for the answer here. So the answer is the this is the false. False is option D. Here the we are used in the patient with the increased ECP. ECT is never ever used. So because this is a false one. Okay. Let me clarify the type of the ECT here. Okay. So type of the ECT, we are having specially two types. If in case we are using the muscle relaxants, anesthesia means that is the modified ECT, and without using the anesthesia, that is and muscle relaxant, we are inducing the convulsion in patient with the as the severe depression and all, and we are giving the ECT means that is without anesthesia, without especially muscle relaxants. So that is the direct ECT. Okay, so direct ECT is nowadays not in the use because of the because why? Because previously what happens when the old age people come to osteoporosis and all, when we give the direct ECT without muscle relaxant and without anesthesia, there is a chance of the fracture and there is a chance of the yes the intracranial hemorrhage bleedings also, students. So because of that, we are using now ECT with muscle relaxant and ECT with specially anesthesia. Okay. So and we are having again we are having the two types of the ECT, where based on the yes the placement of the electrodes, students. Unilateral and bilateral ECT electrodes placement is like this. Okay. Where in the unilateral, yes, I'm trying to explain, so please do watch this one with very carefully. Okay, otherwise you will be in the confusion. Okay. So what they have told in the option, in unilateral ECT, electrodes are applied on non-dominant side of the body, students, not over the brain. Okay, non-dominant side of the body. Here is my, I am the right-handed person. Okay, and left hand is the non-dominant side of the body. Students, actually what I told while telling the anatomy physiology, I told already for you all, that is in the right-handed person, left side brain is dominant. Okay, in the left-handed person. Okay, in the left-handed person, right side brain is dominant. Especially students, where in the strokes while we will study the contralateral effect, where the left brain damages, right side body paralysis occurs, right brain damages, left side body paralysis occurs. So we have studied this one in while studying the stroke. So why I am telling, we need to apply the side of the non-dominant side of the body, means this is my non-dominant side, means if I want to give ECT to my head, where I place my electrodes, I place the electrodes towards the non-dominant side, because this is my non-dominant side, means this side of the brain is the dominant side. So in the option they have given non-dominant side of the body, means the option is correct. If in case they have given non-dominant side of the brain, means that is answer option is going to wrong. Why? Because the dominant brain is always opposite side. In the right-handed person, it's left side, and left-handed person, it's right side. So if we are applying the yes non-dominant side of the body, means we are applying the dominant side of the brain. Okay, for brain they are asking means give answer as the dominant side, and for the body or the for extremities and for the head they are asking means just give the non-dominant side answer. Okay, so here we will applying the non-dominant side. Hope the concept is clear for you. Okay, so here is the two types of the electrode applied applying application technique is there like this. Unilateral means one side we will apply, that is over the non-dominant side of the body, means the dominant side of the brain. Okay, so where the actual how we will apply means, look at me students, while applying the electroconvulsive therapy electrodes, see we'll first monitor the we'll first draw the one imaginary line that starts with the outer or the lateral canthus of the eye and goes to the tragus of the ear. Okay, from the outer canthus of the eye and goes to the tragus of the ear, and from the midpoint of the this imaginary line we will go 1 to 1.5 inch above, like this. From here we will go 1 to 1.5 inch above, or we say that is then 2.5 to 4 centimeter above from the midpoint of the imaginary line we have drawn from the yes, lateral part of the eye, that is the from the lateral canthus of the eye to the tragus of the ear. Okay, so from here, from the midpoint, we are going the 1.5 to 1 to 1.5 inch above, and here is the exact place where we will attach our electrodes. Okay, in the bilateral ECT. Okay, and in unilateral also same side, and one more comes over the at the midpoint of the brain. Okay, here is the actual where we will apply the electrodes in the ECT. Very importantly, draw the imaginary line from the lateral side of the eye and towards the tragus of the ear, and take one midpoint of this imaginary line and go 1.5 to 1 to 1.5 inch above here, or the 2.5 to 4 centimeter above this midpoint, and apply the electrode here. This is the exact point where you will apply your electrode. This is also you asked in your exam many times previously. It was asked. Okay, so here is the concept that clears your is the all doubts. Okay, so let me go for the next question. Here is the bilateral two sides we are applying. Okay, in the unilateral or the non-dominant side of the body, that is in the dominant side of the brain we are applying. Okay, so hope the concept is clear. If you have still any doubt, means just do comment in the comment box. I will respond. Okay, so here's the next question for you all. Just try to read the question carefully and completely and answer for the question. Yes, I am waiting for your answer here, students. Yes, try to answer for the question. Indication of the electroconvulsive therapy includes all except. Yes, students. Where all the area where you are using the electroconvulsive therapies, when the patient comes with a severe melancholic depression and resistant to the all antidepressant medications. If we are diagnosing the patient with the depression and we have given the antidepressants medications, but it is not going to useful to the patient. So patient repeatedly again coming to the OPD and telling that, so sir, whatever the medication you are given to me to improve my depression, so it's not working to me. So that is what we call the resistant depression, when the we are giving the medication and its patient is not improving with the medications. So that is what we call the resistant depression, or the resistance depression, or the severe depression with suicidal thoughts. So what happens in the severe depression, the patient is always having the suicidal thought. So at that point also we will give the electroconvulsive therapy. Okay, that is the severe melancholic depression, also we are using the electroconvulsive therapy. Okay, this is the indication. And when the patient comes with a severe psychosis, okay, severe psychosis means, what is the psychosis? The patient manifests the psychotic symptoms that includes the, yes, the very important hallucination, illusion, delusion, and anhedonia, avolition, apathy, and all. When the patient manifests the all psychotic symptoms, where that point also with the severe psychosis we will use our electroconvulsive therapy to change the and manipulate the function of the brain of the patient. Okay, very important. And in the organic mental disorders also we are using, okay, organic mental disorders like delirium, okay, like delirium and dementia. So both this delirium and dementia comes to our organic brain disorder. Okay, organic brain disorder. So here also we are using when the patient is going to severe symptoms, when the patients will suffer from severe sundowning phenomena and dementia. So where that point also we are using the organic mental disorders. Also we are using the electroconvulsive therapy. But the cerebral aneurysm is a contraindication, students. Okay, where the what happens in the cerebral aneurysm? Cerebral aneurysm means here is the brain, the blood supply of the brain is there like this. When this blood supply of the brain, the blood vessel abnormally get dilates and get weak. So this is what called the aneurysm. That the aneurysm which is occurring in the brain. So we call that is in cerebral aneurysm. So when the patient with cerebral aneurysm, we are giving the current externally, means these blood vessels get ruptures. Okay, so that may lead to the hemorrhagic stroke also. So in the cerebral aneurysm, okay, and in the aortic aneurysm, and in the patient with the myocardial infarction, and in the patient who is having the implanted metallic walls, heart walls, and in the patient with the pacemaker, we will never ever give the, yes, very importantly, our electroconvulsive therapy, because which also disturbs our conduction system. Okay, and in the patient with the pneumonia with severe respiratory symptoms also, we will never ever use the VCT, because which suddenly increases the oxygen demand of the patient, so which may lead to the severe exacerbation of the COPD, where the patient may also go into respiratory arrest also. And in the very importantly, uh, while giving the electroconvulsive therapy, we are using the muscle relaxant also. So because of that muscle relaxant, the respiratory muscles paralysis also occurs. So because of the respiratory muscle paralysis, the improper expansion of the chest and the improper oxygen exchange occurs. So because of that, also COPD exacerbation occurs. Students, when the patient comes with the COPD history, so we will never ever use the ECT. Okay, I hope the concept is very much clear for you. And the question answer for this question goes: the indication of the ECT includes all except that is an cerebral aneurysm, where in the cerebral aneurysm, where we will not use the ECT, because there is a chance of rupture of the blood vessel, which leads to the hemorrhagic stroke. I hope the concept is clear here. Okay, let me go for the next question. Here is the next question for you all. Yes, the contraindication of the electroconvulsive therapy includes all except. Okay, option A is acute myocardial infarction. Yes, I have told in the acute MI, it's an contraindicated. Okay, and in the RISE recipe is the observed contraindication for the ECT. So here also it's contraindicated. And when the patient comes with a brain tumor, there also, yes, very importantly, this is also an contraindication of the ECT, because when the brain tumor patient, we are giving the ECT, the electrical current which ruptures the brain tumor, so which leads to the further spread of the cancer over the head. So that in order to prevent that one, we are not giving the ECT in the patient with the brain tumor. Okay, and option D is the aortic aneurysm. Okay, option D is the aortic aneurysm. This is also contraindication, students. Here is some question printing mistake is there. Contraindication of the ECT includes all except nothing is there. In all the situation we are, yes. These all are the all situation. Yes, we are not giving the ECT, students, because in these situations the patient may go into the severe exacerbation of the situation, which leads to the further damage to the brain also. So because of that, so these all are the contraindication of the, yes, electroconvulsive therapy. We will not giving the acute MI also, raised ICP also, brain tumor also, and aortic aneurysm also. We are not using the ECT. These all given four options are contraindicated for the ECT. Okay, this is the question print mistake. Okay, so let it this one here only. Okay, we'll move for the next question. Here is the question for you all. Read the question carefully and try to answer for the question. Okay, very important question. Mention this one as a 5-star question for your Nimhans exam. Okay, 5-star question. Definitely from this particular question explanation, one question will come. Okay, so not same that this question, but listen to my explanation. So you will definitely mark one question in your Nimhans also and in your NORCET also. Okay. So read the question carefully. Let me read the question also. So option question is like this: which of the following drug is used to reduce the risk of the aspiration in patient who is undergoing the electroconvulsive therapy? So the purpose of the drug is to reduce the risk of the aspiration. Students, so when we give the atropine sulfate, it's an anticholinergic medication. Okay, anticholinergic. Anticholinergics means which decreasing the parasympathetic activity. So we call this is an parasympatholytic also. Also we call this in sympathomimetic, because it's an against the parasympathetic one, means it's a sympathetic action, activity mimicking this one. So we call this is a sympathomimetic also, anticholinergics also, or parasympatholytic also. So what happens in the activation of the sympathetic nervous system? Entire body functions will increase, that including the increased heart rate, including increase respiratory rate and increasing the our skeletal muscle activity, okay, pupil dilation, each and everything occurs, but the GI system function is decreased when the anticholinergic starts action, and when the sympathetic nervous system activates, that time GI system activity decreases, okay, and rest all activity increases. So because of that, decreased GI system activity after giving the atropine because of the anticholinergic effect, the patient mouth become dry. The patient mouth become dry means there is no any saliva, there is no any siluria, there is no any saliva means that increases the that decreases the risk of the aspiration. So the medication which we are using to prevent the aspiration in the ECT is the atropine sulfate, okay, very important one. This is the atropine sulfate. Let me tell the three more questions for the atropine students. Atropine sulfate is the drug which categorized under the anticholinergics medications, okay. Drug of choice for the bradycardia is the atropine sulfate in the adult. Drug of choice for the bradycardia in adult is very importantly students atropine, and drug of choice for the bradycardia in children is the our epinephrine, but in the adult the atropine sulfate is the drug of choice for the bradycardia. And drug of choice for the organophosphorus poisoning, that is the OP poisoning, that usually seen in the farmers who uses the pesticides in their fields. So they will comes with the organophosphorus poisoning, that is then cholinergic poisoning, means all the sympathetic activities will come in the OP poisoning. Like that students, the patient will always hang the drooling of the saliva from the mouth, and his pupils, his pinpoint constricted pupils we will having, and his muscle activities are decreased and paralyzed, and the patient is having the monotonous voice, especially pinpoint pupils and completely drooling of the saliva and completely coming of the eye drops continuously. That is the classical indication of the organophosphorus poisoning. That is the cholinergic poisoning. So at that point in time, we are using the atropine sulfate as a drug of choice for the organophosphorus poisoning, and in the adult bradycardia, we are using the atropine as a drug of choice in order to increase the heart rate students. So very important, two more questions I have told over the atropine sulfate. Okay, this is the anticholinergics we are using to reduce the risk of aspiration in patient who is taking the electroconvulsive therapy. Okay, I hope the concept is clear. And the medication which is using to relax the muscle, that is then the muscle relaxant, we are using the specially electroconvulsive therapy is succinylcholine students. So because where we are using the succinylcholine that relax the all the muscle, after giving the ECT, the muscles will not contract spasms or the spasms suddenly, so that prevents the fracture in the patients. So because of that, we are using the muscle relaxants just before the induction of the electroconvulsive therapy. So especially what we need to monitor who is the when the patient is undergone the succinyl colon or the muscle relaxants means all over body muscles are relaxing students. Along with that, the respiratory muscles also getting relaxed and paralyzed. So when the respiratory muscles get relaxed, there is a respiratory deprivation will come students. So in order to overtake the patient from the respiratory depressions, we need to keep ready all the necessary equipments that is required to ventilate the patient, that including your artificial manual breathing unit, your ambu bag and ventilator, and all form of the respiratory tubes we need to keep. And before starting the ECT in the morning, it's a nursing officer responsibility to check all the function of the all the function of the equipments, whether it is working normally or not. If in case the patient suddenly went into the respiratory depression means we need to start with ambu bag. If the patient is not improving means let the put the patient into the ventilator. So in order to put the patient over the ventilator, we need to keep all the tubes, that is the endotracheal tubes. Okay, even we'll keep the tracheostomy tube, but it's rarely use the tracheostomy tube, but it's our necessary to keep ready because it is an emergency whenever the patient need. So we need to provide it immediately in order to save the life of the patient. That is what we made in, and that is what our mission of the life, we have to save the life of the patient. Okay, hope the concept is very much clear. So if the concept is clearing for you all and you are new to the video means, please press the subscribe button and like button. Don't forget to press the like button students. We are struggling to improve, we are struggling to improve your knowledge. So thanks for believing in the master nursing classes. This is what the quality content Mr. Nagaraj sir and master nursing classes entire team is working to help you students. Don't be in confusion, don't be in anxiety, for the exams. We are here to help you. We will definitely help you. Okay. So I think your concept is clear for the sectional choline. It's a muscle relaxant. It paralyzes the respiratory muscles, and where we need to keep all the equipment in that helpful for the establishing the airway is very much helpful, and it's our responsibility to check the function of the ventilator, function of the ambu valve before giving the the electroconvulsive therapy. I hope the concept is clear for the sectional choline. Let me go for the thiopental sodium. Thiopental sodium is the anesthesia. Okay, it's an anesthesia where we are using in the patient with where you are using the patient who is undergoing the ECT. So this is what the thiopental sodium is the anesthesia, and succinyl choline is the muscle relaxant, and atropine sulfate is the very importantly anticholinergics to decrease the risk of the aspiration. And students, one more very important point I want to tell related to the atropine, where in the atropine students, when we give the ECT, there is stimulation of the vagus nerve also. Our vagus nerve is in parasympathetic nerve, where it decreases the heart rate. All of you know, when we give the atropine to the patient who is undergone the vagal stimulation, if you are already given the atropine to the patient, means the patient vagal stimulation is counteracted by the atropine, means the atropine will not allow the vagus nerves to decrease the heart rate. So that is also helpful point related to the atropine. And when you will give the atropine, if atropine you are giving with intramuscular route, means just give the atropine 30 minutes before the induction of the very importantly our ECT. And if you are giving the IV route, means just give before the ECT procedure. You are giving the IM 30 minutes before the procedure, you are giving IV you just before the procedure. I hope the concept is clear. Let me go for the next question. Here is the next question for you all. I hope the concept is clear here. In the last question, the answer for the question is the option B, atropine sulfate. Okay, we are using this one to reduce the risk of the aspiration. Okay, the hope the concept is clear here. Here is the next question for you all. Which of the following sentence is false about the electroconvulsive therapy? Okay, electroconvulsive therapy के related which of the following is galat? Okay, yes, try to answer students. I am waiting for your answers here. Just read the question carefully. I am asking which of the following sentence is false about the ECT. Okay, yes, option A comes like this: tell to patient withhold the morning drugs, mainly anticonvulsants, barbiturates. Here, students, it's very important. This is true word. This is not in false word. Why? Because we are in the ECT, we are inducing the convulsion to the patient. But if the patient morning took the anticonvulsant medicine, means when we are inducing the convulsion to the patient, it not going to induce and it not going to work because the patient took anticonvulsant medication. So even after giving the ECT, it is not going to helpful because the patient who took the anticonvulsant medication. What is the purpose of ECT? We are artificially inducing the one seizure and the grand mal seizure in the patient. So if the patient already took medication against the grand mal seizure, that is the anticonvulsant medication. So the ECT is not going to work. So it's very important to withhold the morning drugs of the anticonvulsants and barbiturates, which decreases the brain activity. Okay, very importantly. So this is 100% true one. So this is not false one. Okay. So option B is like this: tell the patient for head shampooing in the morning. As 100% true, students. Why? Because if you are having some oil over the your hairs, when giving the ECT, the conduction of the electrodes will disperse here only, it will not enter your brain. So that is what will ask the patient to shampoo your head and clean your head over the morning before the ECT and keep it clean and dry. Very important. Okay. So this is also 100% true one. Okay. And here is the next option for us. Option C is there: tell to the patient stay kneel for oral for 4 to 6 hours before the procedure. Yes, it's mandatory, students. The GI system of the patient should be empty before giving the ECT because we are inducing the seizure. If the reflex of the GI system content will come, means the patient is already in the the succinyl choline muscle relaxant effect, and the patient is already over the the thiopental sodium anesthesia effect, and the GI content comes back to the mouth, means it will enter to our lungs,
which leads to the aspirational pneumonitis, where we want to actually prevent that one. The mandatory nursing intervention is, and it is a responsibility of the psychiatrist, should and must inform the patient to be NFO, that is 4 to 6 hours before the procedure. It's a 100% true one. Option C also. Okay. And here the option D for us, tell to the patient, don't urinate before the procedure. Oh, this is an wrong one, where the false one. Okay. So we need to put our answer here. The answer for the question is option D. Why? Because we'll ask the patient to urinate, and we will ask the patient to empty his bowel and bladder both. So here in the question they have mentioned, tell the patient don't urinate. It's not make any sense here, students, because we will ask the patient to keep the bladder and bowel both empty. Why? Because while giving the ECT, the patient should not pass his urine and feces over the ECT table. So that is what we don't want. So ask the patient to urinate before the procedure. That is our nursing responsibility. Here is the false one about the ECT is the option D. Why? Because we are telling to the patient don't urinate. Means that's false one. We'll ask the patient to urinate. Okay. That is our answer. D is the option D is the answer for the question. Okay, here. So I hope the concept is clear for this question also. Let me go for the next question. Okay. Here is the next question. Let's read the question carefully and try to answer for the question. The side effect of the ECT includes all except, yes. Option A is like this: memory impairment and headache. Yes, students, while studying the seizure topic only, we have studied in detail related to this. Here we are artificially inducing one seizure. So after the procedure, the patient may go into the retrograde amnesia, where the patient will forget the things what is he has had in his previous life. So that is what the retrograde amnesia. And if the patient is forgetting his future plans, means we call that is an anterograde amnesia. But what happens in the generalized clonic seizure, in the post-ictal deficit phase, the patient may experience the retrograde amnesia, and not even he is having the memory of he went in the seizure. Okay, that is also very important. And memory impairment and headache is 100% it will occurs. Okay, this is the side effect. Okay, confusion and drowsiness is there to the patient because we have given the anesthesia and we have given the muscle relaxation. In the after the procedure, the patient may having the confusion, drowsiness also, and restlessness and poor concentration is also there because the patient is under the anesthesia effect, and we have altered the function of the brain of the patient. Okay, the patient may feel the restlessness and the poor concentration also. But the option D, urinary retention, will not occur, students. Here the urinary incontinence will occur. Okay, urinary incontinence will occur. What is the urinary incontinence? Urinary incontinence means involuntary dribbling of the urine. We call the urinary incontinence, where the person don't want to urinate, but some dribbling of the urine is there, that is involuntary. We call that is the urinary continence. That is the side effect of the ECT may occurs, but urinary retention will not happen. So option D is the our accepted one here. Okay, we'll accept this question. Option D here. Okay, very important. So answer for the question goes to the option D, urinary retention, because this is not a side effect of ECT. Side effect of ECT includes the incontinence, where the nursing responsibility here to insert the condom catheter to the patient in order to maintain the elimination of the patient in just a very good manner. Okay, so the catheter of the choice in the patient who is incontinent is the condom catheter. Okay, very important one. So I hope the concept is clear for this question also. Yes. Yes, students, we have done with the electroconvulsive therapy. If you are having any doubt or related to the electroconvulsive therapy, please do comment in the comment box. Definitely, I will answer for your questions. Okay, and now we will move for the very important our neurotic disorders, where I am discussing the anxiety disorders, phobic disorders, panic disorders, and obsessive compulsive disorders. Okay, and very importantly our therapeutic modalities. Okay, so here is the next one. Okay. Yes. Here is the neurotic disorder, students. So in the neurotic disorders, we are studying very important kind of the disorders, that is the generalized anxiety disorders, panic anxiety disorders, obsessive compulsive disorders, phobic anxiety disorders, somatoform disorders, conversion, it's not convulsion, it's a conversion disorder, students. So conver, okay, conversion, SION, conversion disorders, okay, and other neuroleptic, so sorry, other neurotic disorders where we will studying the Dart syndrome, Ganser syndrome, and all. Okay, we'll see each and everything in detail. Okay, so here in this topic, I am covering the generalized anxiety disorder, panic anxiety, obsessive compulsive, and phobic anxiety. So I think all the phobic anxiety disorders we have studied already over the first sessions where I told you related to the all type of the phobia, hydrophobia, xanthophobia. Okay, so if you didn't watch the first day one crash course session, in that one I have told already all related to phobia. Okay, these particular topics we will discuss, and somatoform, conversion, and other neurotic disorders we'll discuss in the next session, students. Otherwise, the session is going to be very much lengthy. Okay, so let me start the question here. So these all things will comes under neurotic disorders, students. All anxiety disorders, panic anxiety, phobic anxiety, and very importantly, obsessive compulsive, somatic, conversion, and other neurotic disorders, always, and dissociation disorders also. So all dissociative disorders. Okay, these all are comes under the neurotic disorders. Okay, where the neurotic disorders, the patient is having the no any impairment in the consciousness and no any organic brain defects, where the patient is also having the lack of patient is also having the intact insight, where the patient is aware about his own disease. So that disease we call the neurotic disorders. Okay, very importantly. Okay, here is the first question for you all related to the neurotic disorder. This question directly asked in your, yes, the last year Nagpur separate AIMS exam. Okay, students, very easy questions that I have asked. Okay, related to the anxiety, apprehension, and uneasiness which is arising, okay, due to the anticipation of the danger. Patient is feeling somewhat apprehension and he is feeling uneasy. Okay, that is due to this some patient is anticipating something dangerous is going to happen to me. Okay, he is anticipating and he is feeling uneasy and apprehensions. That is what we call the anxiety, students. That is what we call the generalized anxiety disorders. Okay, so is an apprehension and uneasiness arising due to the anticipation of the danger is a generalized anxiety disorder, where the panic anxiety disorder means what happens in the panic, how the patients will manifest in the panic. You know, the many panic patients are, I think you have known, related to the features of the panic, where the patient becomes suddenly reactive. Okay, that is what we call the panic. Okay, so we'll discuss the panic anxiety disorders also in the next question. And phobic anxiety we have discussed. In the phobic anxiety, what happens? Patient is having the irrational fear towards the external stimuli. Okay, there is no any rationale, but the patient is fearful towards the particular stimuli. We call that is the phobic anxiety disorder. Okay, in the phobic anxiety disorder, we have already studied the what is the agoraphobia. Okay, agoraphobia is a fear to the open space, acrophobia, fear to the height, claustrophobia, fear to the closed space, and social phobia, that is inability of the person to present and to do any work in front of the or in the presence of the others. That is the social phobia. We have seen all kind of the phobia, students. Okay, so here is the answer for this question goes to generalized anxiety disorder. Patient is having the generalized anxiety where he is feeling the uneasiness and apprehension due to the anticipation of the danger. Okay, the answer for the question is the option A. And what happens in the obsessive compulsive disorder? In the OCD, option D is there. I am telling. So OCD, obsessive compulsive disorder, there is two pages are there, students. Okay, so those two pages I will discuss in the next question. Okay, it is there in the next question. Be wait and watch. Okay, so the answer for the question goes to the option D here. Okay, here is our next question like this. Following are true about the phobic anxiety disorder. Okay, following are the true about the phobic anxiety disorder. So option is like this. Yes, it's an somewhat confusing. I will clear your concept. So I want to differentiate in this question. That is the difference between the panic anxiety, phobic anxiety, and generalized anxiety. Okay. So after solving this question, your concept is very much clear. Okay. So following is the true about the phobic anxiety. If the patient is having intermittent anxiety and unrelated to the situation, means sudden any situations which will suddenly comes to the patient and he is suddenly responding to the patient. Okay, patient is suddenly responding. So that is an characteristics of the phobic anxiety. And for that is the characteristics of the panic anxiety. Okay, so panic anxiety will not occur daily students. It occurs intermittently. Okay, where the patient is internally impulsive and hyper responsive to the particular situation that is unrelated, means that is not particular to the one situation. For any situation the patient will come, at that situation he will respond. Okay, so that is the intermittent and unrelated, means the panic anxiety will never occur on the daily basis. It may occur weekly. Okay, it may occur on the monthly, it may occur in the yearly basis. So we call that as an intermittent and unrelated to the situation. Means only one situation he is panic, means that is a not panic disorder. He is unrelated to the situation. Whatever the situation will come, he is, yes, the panic for that one. That is what we call a panic anxiety disorder. Okay, but what the option B says, persistent anxiety and unrelated to situation, means if the patient is persistently anxiety, means continuously anxiety, means the daily the patient is having the anxiety, means not even to only one thing, for all thing, for unrelated situation, for every situation persistently patient is having the anxiety, means that is what we call the generalized anxiety disorder. But in the phobic anxiety patient is having the intermittent only, but it is related to the particular situation, means the patient will having the, yes, what we call the fear to the only to the water. So we call that is a hydrophobia, means one particular situation is there, only at that point the patient is feeling anxiety, other than that the patient is completely normal. So intermittently it will come and it's related to the particular situation, means that is what we call the phobic anxiety disorder. Okay, phobic anxiety disorder. So here is the answer for the question is the option B, that indicating, sorry, option C, that indicating the phobic anxiety disorder. Okay, so option B indicates persistent and unrelated, means the generalized anxiety, intermittent anxiety and unrelated to the situation, means that is our, yes, the very importantly panic anxiety. What happens in the panic anxiety students, here is the question for you related to the panic anxiety only. So if the patient is having the sudden attack of the anxiety, okay, with predominant physical symptoms are there, like the patient will manifest suddenly, will fall down. Okay, suddenly he will take the what we call some soil and he will throw over the air. So some sudden symptoms, that is the anxiety symptoms, where the predominant physical symptoms are there, followed by the severe consequences such as heart attack may occur to the patient. Okay, and the patient is having the impending doom of death also here, students. The patient may see, patient may feel that I am going to die. Okay, so at that point of the time, that's the that much severe the anxiety occurring is, that is in panic anxiety, students. Okay, that is in panic anxiety, where the word sudden comes, where the word anxiety with predominant physical symptoms comes, where the word consequences will comes with like a heart attack and or impending doom of that indicating, clearly indicating the definition of the panic anxiety. Where in the conversion disorder, what happens, students? Some conflict, some psychological conflict, the patient manifest with the, yes, with the physical symptoms, where the patient try to convert his psychological conflict into physical symptoms. That is what we call the conversion disorder. In the somatoform disorder, where the patient is simply without any medical basis, the patient will complain the pain is occurring, the something is moving. So it is a somatoform disorder. In the somatoform disorder, what happens? There is presence of the many multiple medical sign symptoms without any evidence. That is what we call the somatoform disorder. And in the what happens in the dissociative disorder, in the dissociative disorder there is loss of association in the dissociative disorder, that is related to the memory, personality and identity, where the person memory is impaired, personality is forgotten and identity is changed. So we will study that is what is the dissociative fugue. Okay, and all dissociative perception disorders, we will see all things. Okay, and in the somatoform disorder, conversion disorder and dissociative disorder, next sessions we will see in detail. Okay, so this is the definition of the panic anxiety. Hope the concept is clear for you all. Okay, so here is the question for you all. Yes, the next question. Students, please read it carefully and try to answer for the question. Oh, thank you. Yes, that is the mission of the master nursing classes. Students, we are not simply taking any options and not wasting your times by telling only one answer. In each and every question, the master nursing classes is explaining all the possible questions and all the possible answer how you will put in that situations. That is the specialty of the master nursing classes. Simply copying one question from anywhere and telling that answer, that not going to help students. If the one question is coming, you have to tell, yes, you must and should know that why other three options are wrong also. That is make the difference, and that builds your concept. Okay, so very importantly, yes, the read the question carefully and try to answer for the question. Yes, the repeated forceful thoughts, images which increases the anxiety of the patient is known as, okay, this is of the patient is known as yes, the what the question is telling, the patient is having the repeated forceful thoughts, images which increasing the anxiety of the patient. That is what we call, students, yes, that is what we call obsession. What happens in the obsession? In the obsession, the patient is having the repeated forceful thought which increases the anxiety. Okay, okay, which increases the anxiety. So, what happened to the here is the patient when to his mind repeatedly forcefully some thoughts is coming which increasing his anxiety. So, in order to decrease the anxiety, the patient will do some motor activities. Okay, the patient will do some motor activities. That is what we call the compulsion. Okay, and the repeated thoughts which will comes in the mind, we call that is an obsession. Okay, the repeated thought which enters, repeated forceful unwanted thoughts, images, ideas which entering into the patient mind, we call that is an obsession. Okay, that particular things which increases the anxiety. So in order to decrease the anxiety, the patient is doing some activities, we call that is the confusion, compulsion. Okay, so here is the classical example for you all. And the patient is having repeated unwanted forceful thought of his hands are get dirty. Okay, and after his hand got dirty, the patient feel anxiety and he will go and wash his hand repeatedly. So person, the whatever the thoughts which are coming in the mind of the patient, that his hands are empty, that is an obsession, and where it increasing the anxiety, followed by when the patient is going and washing the hand, so that is the motor activity of the patient, that is what we call the compulsion, and including the, yes, the obsessional thought with increased anxiety and the compulsion act, obsessional thought and compulsional act, we call this is an obsessive compulsive disease. Okay, where which occurs due to the increased 5-HT. Okay, what is the increased 5-HT, or we call the increased serotonin. Okay, 5-HT is the 5-hydrotryptamine. Okay, what we also call, there is a very beautiful neurochemical. Okay, that is the serotonin. That in the obsessive compulsive disease, we will see the increased serotonin level, students. Very, very important. Okay, so the answer of the question goes to obsession, because here the forcibly thoughts are coming and which are increasing the anxiety. Okay, patient is not doing anything. If the patient is doing something, motor activity, that is what we call the compulsion. And the dissociation we have discussed. Okay, where is the loss of association between the memory, personality and identity, where the patient which not having the integrity of these three things, where the patient will go away from the home, that is what we call the dissociative figure. So we will discuss that things in the next session. Okay, so here is the difference between the absence and compulsion word is, I hope the clear for you all. And what is the option D? Is the one beautiful syndrome is there? Yes, that is the our Ganser syndrome. Yes, anyone can answer for this one. Yes, the two times asked question for your NORCET and all. That is the Ganser syndrome. Yes, what happens in the Ganser syndrome? If you are asking something to the patient, yes, if you are asking something to the patient like this, yes, mister, what is the 2 plus 2? Yes, the patient should tell 4 as an answer, but he will tell 3.7. Ganser syndrome is a syndrome of appropriate answers. Okay, near to appropriate answer, not an appropriate answer. Students, where you are asking something to the patient and patient responding near to the appropriate, that is not an actual appropriate. You will ask how many legs the cows is having. So patient will tell 3.7, not 4. Okay, actually the cows are having the 4 legs. Okay, and the patient is telling nearly appropriate answer, he will never ever tell the appropriate answer. That is what we call the Ganser syndrome. The syndrome of in nearly appropriate answer. Okay, that is the Ganser syndrome. That is may asked in your question, because this is also a neurotic disorder. Okay, and dissociation also neurotic, compulsion obsession also neurotic. Okay, so including the both obsession and compulsion, we are having the obsessive compulsive diseases. On this one, many Bollywood movies and many Sandalwood movies are there. You can watch over this one after this video. Okay, so let me go for the next question. Yes, and comment which movie, which Sandalwood movie is there on the concept of the obsessive compulsive disease. Okay, yes, here is the next question for you all. Neurochemical changes which occurs in the OCD, just now I only tell. So it's not due to increase, not due to decreased serotonin, not due to decreased GABA, not due to decreased dopamine, which occurs due to the increase in serotonin. Okay, direct question the examiner may ask in your exams. Okay, so I hope the concept is clear for this one. Here is the next question for you all. Yes, students, in the OCD, we are having the many type of the clinical manifestation. Among those, the important one I will tell here. Okay, the patient is having the uncontrolled, forceful internal debit. Okay, what the patient is having? Internal debit. Internal debit means the patient himself will say for and against, and the for and against arguments. Okay, that is the internal debit means for and against arguments the patient is having even in simple activities of the life. That is what we call. So if the patient is having the internal debate and the for and against arguments over one particular simple life subject, that is what we call, yes, that is what we call rumination, students. Okay, that is the rumination. Okay, so obsessional compulsion, this is what happens if the patient is having the internal debates and for and against arguments over the simple life activities. That is what we call the obsessional rumination, students. And in the obsessional images, what happens? The vivid and bizarre images will comes in the patient mind, like this some war is going in front of his hand. The image of the war will come, and the image of the rape will come, and the image of the fire will come. That is, if the uncontrolled forcefully some images are coming in the mind of the patient, means that is what we call, yes, the obsessional images. In case the vivid doubts will coming in the patient of the hand, we call that is then the obsessional doubt. And if the patient is having, if the patient is having uncontrolled forceful thoughts about the, yes, the rituals, means what is the rituals? Rituals are the daily living activities where he is performing that uh, activity repeatedly means how many times you will wash your face in the day? Yes, maximum, and maximum means three times, in the morning, afternoon, and evening. Three times you will wash your face. But in the rituals, obsessional rituals, that patient will repeat the washing his face 10 to 20 times in a day. Okay, the what are the rituals? Means the daily living activities, normal activities, he will do that one repeatedly, means that is what we call the obsessional rituals. Where the patient is having the repeated forceful doubt in his hand, means what happens in the obsessional doubt? Yes, the patient is uh, sleeping at the night. Okay, after finishing his kitchen work. Okay, and after sleeping he will thought that whether I made off my gas or not. Yes, he will go and check his gas log, and it's an off. Okay, it's off. Okay, then again the patient will come and sleep over the bed. Okay, after again 30 minutes he will again think whether my gas button is off or on. Yes, again he will go and check. So repeatedly he is having the doubt. And whether if he is going to the shopping outside, and he is or she is locked his home, and while going he will again think whether my home is locked or not. She will come and check, and she will go again, she will come and check, she will go. This is the, yes, the obsessional doubt the patient is creating in his mind. That is what we call the, yes, the obsessional doubt. And obsessional rituals means the daily living activities are done many times in a day, we call that is then obsessional rituals. Okay, here is the question: is the internal debate and far and against arguments over one simple life activity, we call that is then the obsessional rumination. Okay, option B is the correct answer for this one. I hope the concept is clear for you all. Here's the next question for you all. Yes, next question for you all. Which of the following, which of the following therapy useful in anxiety disorder? Yes, try to answer for the question, students. Here I will explain all these three given options here. Don't worry, because these three options more important. The any questions may comes out of any three these three options. Okay, so I will explain in detail. Don't worry. Yes, try to comment for this question. Which of the following therapy useful in the anxiety disorders? Yes, yes, yes. Very good, students. Who all are mentioned answer is an option D. Yes, you are 100% correct. It's an all the above. Systemic desensitization also we are using. Flooding also we are using. Aversion therapy also we are using. Okay. And again we are using the yes the thought stoppage procedure also we are using. And exposure and response prevention modality also we are using. And relaxation techniques also we are using. One by one we will see this one. Okay. One by one. Yes, what happens in the systemic desensitization? The word itself telling systematically desensitization means we are doing the one by one process. So that is what we call the systematic. Okay, systematic. So what we are doing, we are desensitizing the patient anxiety. Okay, so we are desensitizing the patient anxiety means we are removing the patient from the anxiety. So what is the exact procedure which we will do in the desensitization to remove the patient from the anxiety? The procedure may ask in your exam. Okay, with big options. Okay, let me clarify your question here on. Okay, what we are doing the systemic desensitization? First, we will identify all those anxiety causing agents. Okay, and we will keep it separate, and we will ask the patient. First step is we will ask the patient to relax completely. Okay, after relaxation we will ask the patient to prioritize and mention the hierarchy of the anxiety causing agent from descending manner. Okay, so less anxiety causing agent first and the most anxiety causing agent or the last. Okay, so we will ask the patient to list the all anxiety causing agent situations in the descending manner. Okay, first we have made the patient relax, then we will ask the patient to set the hierarchy of the yes the anxiety causing situations. Then after that we will desensitize the patient by exposing the patient with imagination or to the practically. Okay, three important steps we are doing. First we will relax the patient, then we will set the hierarchy. After setting the hierarchy we will desensitize the patient. Okay, so what are the techniques we will use to relax the patient? That may ask in your exam, students. The techniques, basically with yoga we will use basically the relaxation techniques. Okay, the concentration phases we will use. Okay, and one more muscle relaxation techniques we will use, students. That muscle relaxation techniques we call that is an Jacobson muscle relaxation techniques. We'll ask the patient here in the Jacobson muscle relaxation techniques. We'll ask the patient to constrict his all complete muscle for in 30 seconds and completely relax it, tight it, relax it. This is what we call the Jacobson, yes, the muscle relaxation techniques, where the entire diversion of the patient is over the muscle complete contraction and relaxation, and his brain become very cool and calm. Just you also try after doing these sessions. It's very helpful. Jacobson muscle relaxation techniques, where we are asking the patient to constrict the muscle and relax, for the entire body become completely relaxed. Okay, so this is what the relaxation techniques. Like biofeedback also we will use. What is biofeedback? Biofeedback is we will ask the patient to image the pleasure moment what he had in his previous life. Like the very pleasure moment for the person is like his marriage situation. Okay, or like his birthday situation. If the patient is imaging his pleasure moment, his good things, means the person will imagine the happier he is in the happier state, means his brain become very cool, calm and relaxed. That is how the biofeedback works. How the what the principle of the biofeedback means? We are trying to take the autonomic nervous system in our control by using the biofeedback, and it's practically possible, students. Many people have done this one. And how means if the heart rate is increased, that is autonomic under the autonomic nervous system. Just keep quiet, relax and imagine the good things what you had in your previous life, so that decreases your heart rate automatically, means your autonomic nervous system came in your control. So this is the basic principle where the biofeedback works, where the autonomic nervous system is in taking in our control. That is what we are doing the biofeedback, students. That is very important one. Okay, so this is also relaxes the patient, means the first step we have done, we have relaxed the patient. Then after relaxation we will ask the patient to set the yes very important what we call the priorities of the his anxiety causing agent. After setting the priority, okay, we will desensitize. Means how we will desensitize? We will ask the patient to image the anxiety causing agent. Okay, then when the patient is start imaging, so the anxiety will arise in the patient. So after arising the anxiety, we will ask the patient to inform us or the notify us when you are getting anxiety. So during the imagination, the patient is getting anxiety means then stop imaging the whatever the is anxiety causing agent, and then again apply the, yes, the very important relaxation techniques. This is how three steps we will follow in the systematic desensitization. Very very important for our theory purpose also, and very important for our, yes, competition purpose also. Here we are using these techniques in the phobia patient, okay, in the sexual problem, okay, like monosexuality patients. We are using this one, systemic desensitization. And what is the flooding? Flooding means we are exposing the patient suddenly to the particular anxiety causing situation, and from in that circumstance we are made the escape is made impossible, okay. So we are not allowing to escape the patient from that situation, and repeatedly exposing to the anxiety causing agent, patient creates the resistance, and continuously therapist is uh, counseling the patient by suddenly exposing to the anxiety causing agent. That is what we call the, yes, the flooding. If the question is asking like this, sudden exposure to the anxiety causing agent where the escape is made impossible, this technique is called as, that's the technique is called as the flooding, okay. And aversion therapy, all of you know that one, where we are pairing the, yes, the one good thing with the bad thing, where in the absence of the bad thing, and good thing also looks like bad thing, okay. So where we are using the aversion therapy, we are using the aversion therapy in the treatment of the patient with alcohol dependence. As an aversion therapy, we will use the disulfiram medications, okay. Here also we are using the, yes, the aversion therapy to detach the patient from the anxiety, okay. So I hope the all questions are clear for you all, and the answer is the option D, okay. We are having the other therapies also. We are using the treatment of the, yes, very importantly our anxieties. That is the thought stoppage, where we will ask the patient to image the anxiety causing agent. Where the patient start imaging the anxiety causing agent, we will tell three times stop, stop, stop. So that is what the thought is stopping, where the patient is detaching from the anxiety, and we will divert the patient for the other activities. So repeatedly three times in a day we will do the thought stoppage, so that works so much to detach from the anxiety, okay. And another one is the exposure and the response prevention, where we will ask the patient to we will expose, we will expose the patient for the particular anxiety stimulating agent. Like we will make the patient hand very dirty, and when the patient runs to wash his hand, we will not allow the patient to wash his hand, and we will counsel the patient, nothing will happen, don't wash the hand repeatedly and all. We will counsel the patient. That is what we are exposing to the environment, and we are preventing the response by stopping the patient, okay. That is what called exposure and response prevention. This is also we will use in the patient with OCD, where the patient will repeatedly wash the hand and he thinks his hands are dirty. So that is what it's helpful for the OCD patient, obsessive compulsive disorder patient, okay. And relaxation techniques like yoga, Jacobson muscle relaxation techniques, that is also we are using to relax the patient with the, it's the anxiety disorder. I think this video is very very helpful for you all, and if the content is found helpful for you all, and it's, if you are thinking this is helpful for you all, please do subscribe to the channel, okay, and share this content with your friends. Students, we are also struggling to help you, and we are also taking time separately for you to help you, okay. To do please do support the channel, share with your friends in your college groups, okay. That is actually our motivation. And if you are new to the video, please do subscribe to the channel, okay. And don't forget to press the one like button, yes, that particular like which is a motivation for us to bring the more informative sessions for you all. So we will meet in the next class, that is in the day 5 session for the Nimhans crash course. Tab tak ke liye jai hind, jai bharat. Thanks for believing in the master nursing classes, and thanks for believing in the Mr. Nagraj sir. We will meet in the next video. Thank you so much.